How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, no, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a battling stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Wherever you stand, get the fresh view of what's happening in Scotland with iScot. Celebrate everything about our country with intelligent, in-depth insight from lifestyle, culture to puzzles, and all the opinions you'll need. Whether it's digital or by post, subscribe now to iScot.
To review COVID restrictions regularly. The latest review is due tomorrow, and I will shortly set out our conclusions and the reasons for those. I'll also give an update on two developments today. Firstly, the laying of new regulations on face coverings and the publication of further details on how businesses affected by the temporary restrictions announced last week can apply for support. And lastly, I will talk a bit about the Scottish Government's proposed new strategic approach to tackling COVID and how we intend to involve Parliament in the development, agreement and implementation of that approach. But first, I will give an update on the daily COVID statistics. The total number of positive cases reported yesterday was 1,351. That represents 17.6% of people newly tested and takes the total number of cases to 44,036. 450 of the new cases were in Greater Glasgow and Clyde, 374 in Lanarkshire, 161 in Lothian and 111 in Ayrshire and Arran. The remaining cases were spread across all of the other mainland health board areas. I can also confirm that 601 people are currently in hospital, which is an increase of 31 since yesterday. 51 people are currently in intensive care, that is 2 more than yesterday. And I very much regret to report that in the past 24 hours, an additional 13 deaths have been registered of patients who first tested positive over the previous 28 days. That means the total number of deaths under the measure used in our daily figures is now 2,585. Once again, I want to send my deepest condolences to everyone who has lost a loved one to this illness. These figures confirm the trends of recent weeks. We're seeing high numbers of new cases leading to increasing hospital and ICU admissions and, sadly, to a rising number of deaths. Even in the 9 days since I set out the new restrictions on hospitality, the average daily number of new cases in Scotland has risen from 788 to 1,178. The number of people in hospital with COVID has increased from 262 to 601, and the number of people in intensive care has doubled from 25 to 51. However, for all that, it is still the case that we are in a stronger position than in March. Infection levels are still lower, cases are still rising less quickly, and of course Test and Protect is taking a lot of the strain of controlling the virus. And although we are not yet seeing the impact of this in our statistics, we acted quickly to introduce restrictions on household gatherings 3 weeks ago and on hospitality last week. But the fact remains, for us as for countries across the world, this is a critical moment and our position is precarious. That demands tough decisions from government, even if those decisions are understandably unwelcome. And it also demands a willingness on the part of each and every one of us to behave in ways that will hinder the virus rather than help it spread. For all these reasons, I must confirm to Parliament today that all of the existing COVID restrictions and guidance will remain in place for now. That means we should all continue to work from home if at all possible. None of us should visit other people's houses except for extended household arrangements or essential reasons like childcare or looking after a vulnerable person. Outdoors or in indoor public places that are open, we must limit gatherings to a maximum of 6 people from no more than 2 households. Bars, pubs, restaurants and cafes outside the 5 health board areas with tougher restrictions can only open indoors until 6 p.m. for the service of food and non-alcoholic drinks. Pubs, bars and restaurants in Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley must remain closed completely, indoors and outdoors. Cafes in these areas can open until 6 p.m. only. People living in any one of these central Scotland areas should not travel outside their own area unless they really need to, and people in other parts of Scotland should not travel to those areas unless it is absolutely necessary. We're also asking people to avoid travel to areas of high risk in other parts of the UK. The detail of which areas are in these categories will be kept updated on the Scottish Government website. And we are specifically asking people not to go on trips to Blackpool unless necessary. Yesterday I said that over the past month, 180 people who had tested positive for COVID reported recent travel to Blackpool. I can report that that figure is now 286. These restrictions are hard. They're hard for individuals and they are hard for businesses, but they are essential. They mirror what many countries across Europe are doing, and we hope and believe that they will have an impact on transmission. However, I must be clear that we will keep the situation under review and propose further measures if we consider that to be necessary to keep people safe. And I will say more shortly about how we will approach decisions in the weeks ahead. Firstly, though, let me touch on 2 other matters. I indicated to Parliament last week our intention to introduce new regulations on face coverings, I can confirm that regulations are being laid today and 2 measures will come into force tomorrow. The regulations, in one respect, will actually deliver some flexibility. They will exempt a couple from having to wear a face covering during their marriage or civil partnership ceremony. This is a small but important change which I hope will be welcomed by anyone about to tie the knot. However, more significantly, the regulations will bring the rules on wearing face coverings in workplace canteens into line with rules in restaurants and cafes. So from tomorrow, anyone in a workplace canteen will have to wear a face covering when they are not seated at a table, for example, if they are queuing or entering or leaving the canteen or going to the bathroom. A further change will take effect on Monday. This will require face coverings to be worn in other communal workplace areas such as corridors. The responsibility for complying with these measures rests with individuals, but I would urge employers to take steps in their workplaces to explain and promote the new regulations. The new rules are a proportionate additional step which will help employees keep themselves and their colleagues that bit safer. The second issue I want to touch on briefly relates to support for business. I made clear that we would support businesses and workers affected by the temporary restrictions announced last week. In total, we're making £40 million of support available. That includes a £20 million grant fund, which will be administered by local authorities. Details of the application process for that fund have just been published or are just about to be published on the Scottish Government's website. Local authority websites will be updated next Tuesday to allow applications to be made, and it will be possible for businesses to apply at any time in the 2 weeks after that. I would encourage all eligible businesses who need support to apply. There is, after all, an important principle here. Many businesses are being required to take drastic action to help us tackle COVID, and so it is essential that we take significant action to help them too. The new regulations on face coverings and the availability of support for businesses are the 2 immediate issues I wanted to highlight today. But I also want to look ahead briefly to our approach to managing the virus in the weeks and months to come. Last week, we introduced tough temporary restrictions affecting hospitality in particular. The regulations giving effect to these temporary restrictions on hospitality are due to expire on the 26th of October. However, it is important to stress, though I believe everyone already understands this point, that given the ongoing challenge of COVID, that will not herald a return to complete normality. The restrictions on household gatherings, for example, will remain in place until it is considered safe to ease them. And more generally, we intend to replace the temporary restrictions with a new strategic approach to managing the pandemic. Part of this new strategic approach will set out the different tiers or levels of intervention and restrictions which may be applied in future either locally or across Scotland, depending on how the virus is spreading. When we publish this new framework, which will then of course be subject to debate and decision by Parliament, we will indicate, based on the latest advice from the National Incident Management Team and from our clinical advisors, what level of intervention should apply to each part of the country when the temporary restrictions end on 26 October. The tiered approach to intervention will clearly be a central part of the new strategic framework. However, I want to stress that the framework will go beyond that. It will also seek to strengthen and improve the effectiveness of measures which we currently have in place to strengthen our resilience to live with this virus for the period ahead. For example, it will set out our work to improve compliance with the facts advice, with a particular focus on supporting people to self-isolate when they are asked to do so by Test and Protect. It will also outline the support we will make available in future for businesses if they are required to close. It will describe how we will continue to support people on low incomes for whom the COVID restrictions can have especially harsh impacts. And it will draw on the conclusions of our ongoing review of our testing strategy. It will set out our future projections of testing capacity and also the clinical decisions that we have reached on how that capacity can be most effectively used to suppress the virus through the winter months. In the week ahead, we intend to share and discuss the provisional content of the strategic framework with other parties. That cross-party engagement will include the offer to party leaders of a detailed briefing session with myself, the Health Secretary and the Government's key clinical and technical advisors early next week. Mike Russell is also facilitating discussions on how Parliament as a whole can better scrutinise not just this forthcoming framework, but future changes to COVID regulations more generally. A global pandemic of an infectious virus will often require emergency action and quick legislation. But as we prepare to live with COVID for an extended period, we recognise that this imperative must be balanced by the need for robust and, whenever possible, preemptive parliamentary scrutiny. We therefore intend to work across the Chamber and across wider society to ensure that we get this balance right in the weeks and months ahead. One of the reasons why that is so important is precisely because we are at such a critical and precarious point in our journey through this pandemic. Scotland has already acted first among the nations of the UK in applying tough restrictions. We have done so at a time when our levels of COVID, although far too high for comfort, are actually lower than in the other UK nations, and I believe and expect that this will make a difference. But although we have put in place tough measures, we cannot rule out having to go further in the future. For example, the approach to travel being adopted by the Welsh Government to mitigate spread of the virus from high to low prevalence areas, not just within each of the 4 UK nations, but also where necessary between the 4 UK nations, needs to be considered here too and is being considered here too. So as we consider these issues, plan future steps and where necessary take emergency action, we will seek to ensure that Parliament is fully informed and involved in these decisions. Presiding Officer, the final points I want to make today are about context, perspective and individual agency. And I make these points to acknowledge, not in any way to minimise, what we are all going through right now. I am acutely aware that as we enter winter, with tough restrictions still in place and mounting worries for many about jobs and livelihoods, it can be hard to escape feelings of despair and helplessness. But I want to encourage everyone to hold on to some key truths and to the hope that comes from these. Firstly, this pandemic will not last forever. It will pass, and we will hopefully soon be able to foresee a time when we can start to talk about it in the past tense. Second, we are not alone, either as a country or as individuals. This is a global pandemic. Countries across the world are going through exactly the same as we are going through, and they are taking the same decisions Scotland is being forced to take. Here in the UK, Northern Ireland has introduced tough new curbs in the past 48 hours, reflecting the very high prevalence of the virus there. Additional restrictions are being introduced in parts of England, and as I mentioned, Wales is introducing further restrictions on travel. Across Europe, restrictions on hospitality and other facets of everyday life have been reintroduced recently in Belgium, the Netherlands, France, Spain, Germany, Ireland, and many other countries as well. Governments and populations around the world are wrestling with how to tackle and live with this virus, and we must try to learn from each other. And here at home, I know many are struggling with feelings of loneliness, isolation, and anxiety. But support, both practical and emotional, is available if you need it. You can find details of it on the NHS Inform website. And as we deal with the difficult few months that lie ahead, let's all remember to be kinder to each other than we might normally be. Look out for people, offer help if you can, and remember, this is no one's fault. Our experiences are different, I know, but this pandemic is something that we are all living through. None of us are exempt from the impact, and we are all finding it hard. So let's try to help each other as much as we possibly can. I know it can sound cliched, but I will make no apology for saying that love, kindness and solidarity are more important now than ever before. Even just a smile and a kind word can help make a tough day slightly better. So never ever underestimate the difference we can all make in ways large and small to help each other through this difficult period. And thirdly, remember this, that we can't magic it away, unfortunately, or guarantee that we won't get it or pass it on. None of us are powerless against this virus. We can all, we must all act and behave in ways that will help stop it in its tracks. That will make us safer as individuals, it will help protect our loved ones, our wider communities and the NHS, and it will save lives. So difficult and frustrating though I know it is, please abide by all of the rules and all of the guidance. It is there for our individual and our collective protection. And finally, remember facts. Face coverings protect other people and they help other people protect you. Avoiding places with crowds of people also protects you and others. Cleaning your hands and surfaces does that too. Keeping 2 metres distance from people in other households reduces the chance of the virus spreading from one person to another. And self-isolating and getting a test if you have symptoms will break the chains of transmission too. Now more than ever, it is vital for all of us to follow all of this advice, to do everything we can to beat COVID back. By doing so, we will protect ourselves, we will protect those we love, and we will protect our communities. We will help our NHS care for those who need it, and above all, we will save lives. Thank you.
Thank you, First Minister. Now, I intend to allow about 50 minutes for members to ask questions, starting with the party leaders. So our first question from Ruth Davidson.
Presiding Officer, and I thank the First Minister for advance sight of her statement and myself and my party to family and loved ones of those who's lost their lives in recent days. In the last week, we've seen outbreaks of COVID close wards at both the Queen Elizabeth Hospital in Glasgow and the Western Infirmary. The Edinburgh outbreak in my constituency has been particularly devastating, focusing as it has. It has also increased anxiety among visitors to patients in other wards and those being treated in the affected wards itself, by definition immunosuppressed and being told they cannot leave a ward where COVID is present. Investigations are underway to establish how the virus was brought on, and no one would seek to prejudge the outcome of those investigations. Neither, given what we've seen of isolation and end-of-life care during the pandemic, would we seek to further restrict loved ones from patients' bedsides in such circumstances. But patients, staff and visitors need reassurance that everything possible is being done to stop the transmission of COVID within hospital settings, and to ensure as far as possible that those who may be asymptomatic do not bring the infection onto hospital estates. From both constituency correspondence reports surrounding both outbreaks, issues have been raised surrounding checks and controls once people have come onto each campus. So to that end, can the First Minister say whether further infection control measures, such as temperature testing, being considered on a ward-by-ward basis across Scotland's hospitals?
Thank you, Ms Davidson. I'm afraid the sound quality is a bit bad, but hopefully the First Minister gathered most of that question.
Can I apologise in advance, Presiding Officer? It was very difficult to hear and the sound was breaking up. I certainly got the general thrust of Ruth Davidson's question, but I didn't necessarily get all of the detail, but I will do my best to answer it on the basis of what I was able to hear. Hospital-acquired infection at any time is a concern, and particularly right now in the context of COVID, it's a concern. We are advised on the steps that it is necessary and appropriate to take by the National Antimicrobial Hospital Associated Infections body, and we take their advice and will continue to take their advice. There are a number of steps in place, and sometimes, and I know the impact this has on individuals, it includes restricting visiting to hospital and a range of other measures that are in place. A number of groups of people are tested going into hospital. That includes all admissions of people over 70, all ICU admissions, all symptomatic admissions, all elective surgery, inpatients, all those going in for organ transplants, and all inpatients, including those who are asymptomatic in wards with an outbreak, and of course all people who are discharged into care homes are tested as well. In response to what I think Ruth Davidson asked about the possibility of introducing temperature checks, we will continue to keep all of that under review and take decisions based on clinical advice. The other point I would make is we publish weekly now figures on nosocomial hospital-acquired infections, and we continue, the Health Secretary and I, to be updated and advised by the Chief Nursing Officer and the Deputy Chief Nursing Officer about the situation in particular wards and hospitals and the steps that are being taken. Infection prevention and control, both in the sense of preventing COVID getting into hospitals, but controlling it and preventing its transmission in hospitals, is of paramount importance, and we will continue to make sure that everything possible is done, including, my final point, the appropriate provision of PPE for those who work in our hospitals.
Thank you very much, First Minister. Richard Leonard.
Thank you, Presiding Officer, and can I also thank the First Minister for advance sight of her statement, and can I also add our condolences to all of those who have lost loved ones to COVID-19 over the last week. I've spoken many times before about the importance of public consent in the backing for public health measures in the fight against the pandemic. And now we have seen the minutes of the SAGE meeting of the 21st of September, attended by Scottish Government advisers. So we now know that they concluded that over the course of the next 6 to 9 months, multiple circuit breakers may be needed. That testing must be a priority. And they also said that to be effective, measures must be, in their words, consistent without ambiguity or contradiction, that they should be equality proofed, and again, in their words, co-produced with the early engagement of those most likely to be affected. Despite this, the First Minister last week chose measures which were imposed with no engagement of those affected, which have resulted in ambiguity and confusion, and which will hit hardest those on the lowest incomes. Meanwhile, the current test and trace strategy and system is not good enough. So can the First Minister explain to us why she ignored that scientific advice?
First Minister.
The Scottish Government absolutely did not ignore the scientific advice from SAGE. In fact, I think if we look at the actions of governments across the UK, the Scottish Government acted to implement many of the recommendations that SAGE made. As I have set out previously, governments have to take account of the scientific advice, and of course, the further we go into this pandemic, we must balance the imperative of stopping the virus with the harms that are done through some of the measures that we have to use to do that. So we have to reach balanced decisions that stop the virus, protect people's jobs and livelihoods, and wider well-being and health as well. So we reach balanced decisions. But if we look at the recommendations that were made by SAGE on the 21st of September, one of those was a nationwide ban on people visiting other people's houses. We introduced that on the 22nd of September. We were the only government in the UK at that time to do that. The SAGE advice also said that there should be restrictions on hospitality. We introduced significant restrictions on hospitality nationwide last week, and even more significant restrictions in 5 health board areas across central Scotland. And Richard Leonard has indeed last week and today, as he is entirely entitled to do, raised criticisms of the government for doing that. The other aspect of the SAGE advice, which has been consistent Scottish Government advice, is to work from home where possible. And although we did not move to a completely online approach to university education, because we believe it is important for young people to have some semblance of normality in their student life, we put in place tough guidance to help universities manage the start of the term. So actually, the Scottish Government, and all of this of course has been done at a time when our schools were starting to go into the holiday period. So I would argue that the Scottish Government has actually taken the SAGE advice and implemented that. Two final points I would make. Firstly is about public consent and support, and I agree with that very strongly. It's one of the reasons I every day speak directly to the public and take questions from the media, because I think it is important to constantly set out not just our decisions but our reasons for them. And I believe there is strong public support for the approach we are taking. That is not the same as saying the public are happy or welcome all of these restrictions, but I believe the public understand why they are so important. And secondly, I do agree that there needs to be the right balance struck between the need, as I set out in my remarks, to take quick, decisive action in the face of a pandemic of an infectious virus, but have as much consultation and engagement as possible. And that is particularly important as we go into this next phase of handling the pandemic, which is why I set out the approach we will take to parliamentary engagement starting next week, and we will seek to consult with wider society as much as possible. But I will make no apology on occasion, given the nature of the threat we are dealing with right now, of being prepared to take quick, firm and decisive action if we deem that is necessary to save lives.
Thank you. And Patrick Harvey.
Thank you, Presiding Officer. As others have done, can I add my deepest sympathy to those who've lost someone due to this virus, are concerned for those who are still suffering from it. And I thank the First Minister for the statement and welcome in particular the fact that it recognised that the new framework must give greater emphasis on supporting those who need to self-isolate. This is an area that clearly needs more attention. The First Minister has also said that the review of the testing strategy will be done at the same time. We'll see the outcome of that review at the same time as the new framework. Yesterday, though, we learned that the September meeting of the nosocomial review group, which the First Minister mentioned, already approved a new testing strategy for hospitals in line with that published by the European CDC. That means a greater role for regular, weekly, routine testing. Now, I welcome this, but can the First Minister say why this decision was taken in advance of the review of the general testing strategy? Have other decisions about testing been made in advance of that strategy? And does this signal a new acceptance on the part of the Scottish Government that routine weekly testing on a much bigger scale than we've seen to date has a critical role to play in tackling the virus?
We've not. My apologies, President Officer. We've not reached final decisions on the review of the testing strategy. That review is underway. The session that I mentioned in my remarks that party leaders will be invited to early next week will be an opportunity to share our current thinking and get views of party leaders before we finalise the decisions. But yes, we've not just in Scotland, but many countries have had debates and had decisions to make about the balance between symptomatic testing, which has to be the priority because that's catching people who have the virus, identifying their contacts and breaking the chains of transmission on the one hand, but testing on a more routine basis groups of asymptomatic people. And we have been doing that in certain groups for some time now, most notably those who work in our care homes who are tested on a weekly basis, and I set out some of the groups of people without symptoms that we would test going to hospital. We will be looking to extend that, but which groups we select for routine regular testing has to be driven by clinical advice and considerations. Clearly it has to be something that we can deliver within our capacity, but we are increasing capacity substantially. But we have to take clinical advice about the areas where that is likely to be most effective, particularly when it comes to affecting the vulnerable, and also helping to suppress the spread of the virus, and those are the clinical voices we are listening to, and as I say, we will share our up-to-date thinking with the other parties early next week. One group that I have been openly talking about this week, and I stress no decisions have been taken, but it is under active consideration, are visitors, regular visitors to care homes, because that would be another way of protecting people in care homes while allowing greater normality for visiting arrangements. But these are all issues under consideration, and we look forward to updating next week and bringing final proposals to Parliament the week after.
Thank you. Willie Rennie.
Last week alone, 567 people waited over 2 days to get a call from Test and Protect. It is alarming that months after the pandemic first hit, the government is still playing catch-up on this. When will these dangerous delays be eliminated? The First Minister says that she expects the current restrictions to make a difference, but the medical officers say that the R number will still stay way above 1. So the restrictions won't make enough of a difference, will they? As the First Minister's virus continue to grow, what does this mean for the elimination strategy? And are we stuck with a package of restrictions that the modelling says just won't work?
First Minister.
Willie Rennie froze in the middle of that on my screen, unfortunately, so I missed part of his question, but again, I think I got the thrust of it. In terms of Test and Protect is working incredibly well. There is a frustration that I have talked about openly over recent weeks. It is improving, but it is still not as reliable as we want it to be, which is the time it takes from somebody being tested through the Lighthouse Laboratory network, that test being processed, and the result of that test going into the Test and Protect case management system. That turnaround time is not as quick as we want it to be. That is part of the UK government system, and we are working with them to improve that. However, the performance of Test and Protect from the time a positive test result is notified to individuals being successfully contacted and their phone interview completed is extremely high. Almost 95% of those contacts take place. These are figures for the most recent week. Take place within 48 hours. And in the last week, just to give some context, that was almost 3,500 people contacted within that time frame. So Test and Protect is working well. I would never stand here and say that there are not improvements we want to make and further resilience we want to build into that system. It is still, on the scale it's operating on just now, a relatively new system, so we have to strengthen it as we go along, and that is happening. But equally, I am not of the view that anybody should be suggesting to the wider population anything other than that is a system that is working well, because we need people to have confidence in it, because it's important that anybody who has symptoms comes forward, gets tested, and then when they are positive and contacted by Test and Protect, or their close contacts are contacted in that way, then the advice to self-isolate is abided by. So we will continue to take the steps to strengthen that and work with the UK government to strengthen the parts that are not within our overall control. In terms of the measures and the success of them, we've introduced measures that we hope to see bring the R number below 1, but I've said if our ongoing assessment, and we assess these things on a daily basis, although there is a lag effect between measures being introduced and having an effect on the figures, we will not hesitate to introduce additional restrictions, and we will come forward with proposals should we consider that to be necessary. But the restrictions that have been in place in Scotland for the last 3 weeks and over the last week have been the toughest restrictions in place anywhere in the UK, both in terms of household restrictions and more recently hospitality restrictions. Of course, we see Northern Ireland now going further, which I think is absolutely justified. Northern Ireland's prevalence of COVID is around 2.5 times higher than Scotland's is right now, but we continue to keep all of this under review, and we continue to take whatever steps we consider necessary. I think Willie Rennie and I are going to, Willie Rennie is going to continue to ask me about the elimination strategy. I'm going to continue to try to explain to him what the elimination strategy is, and he's going to continue to sort of stand up and ask questions suggesting that he hasn't heard those answers. That's all entirely fine. We haven't given up on an elimination strategy. An elimination strategy is not eradication. COVID can only be eradicated when we've got a virus or immunity at a level that will allow that to happen. What an elimination strategy is that your policies are designed to drive the infection as low as possible. When you are in the period we're in just now, going into winter, that's a harder job than it is over the summer when everybody's still in lockdown. But that objective of driving the infection as low as possible, using this period to try to strengthen the ways we do that while we have temporary restrictions in place, is certainly very much our objective and will continue to be our objective. And incidentally, partly because of the initiative of the Scottish Government, it is now the stated objective of all 4 UK nations.
Thank you very much, First Minister. We have a question from Annabel Ewing, to be followed by Jamie Green. Annabel Ewing.
Thank you, Presiding Officer. I very much welcome the Scottish Government's plans to develop a new strategic framework to take account of the evolving progression of COVID-19. Can the First Minister provide an assurance that in that work the Scottish Government will continue to take into account the advice and modelling from SAGE along with any other emerging scientific evidence, and that advice will be published so that the public can better understand the reasons for the decisions being taken? Thank you.
First Minister.
Yes, we will continue to be driven by scientific and clinical advice. Of course, as I've said before, governments require to reach balanced decisions that recognise that the ways in which we tackle COVID have consequences themselves and do harm to people economically, socially and in terms of well-being. So we need to reach balanced decisions that minimise the overall harm that COVID is doing to our society, our economy and to our everyday lives. And in that we will be very much guided by advice from bodies like SAGE. I've already set out the steps that the Scottish Government took in light of the SAGE recommendations back in September. We will also continue to seek to coordinate and align our actions as far as possible with other UK nations. I participated in a COBRA meeting with the Prime Minister and other devolved governments on Monday of this week. We have looked and are looking carefully at the UK Government's three-tier system for England. I've said it would make sense to try to align the strategic approach as much as possible, even although operational decisions will be for each of us to take. But it's important that we get that overall strategic framework right for Scotland. And of course, earlier on in the pandemic, we established the CMO's COVID advisory group with the specific purpose of ensuring consistent scientific and technical advice is given to me and to ministers based on Scottish circumstances, and we will always look at how much of the advice that is coming to us is published and hope to expand that in future. Last week, of course, for the first time, we published a paper from our clinical advisors setting out the evidence behind the decisions we were taking. So we will both be guided by clinical and scientific advice and, of course, the wider factors that we have to take into account and seek to share as much of that with Parliament and the wider public as we can.
Thank you. Jamie Green, to be followed by Maureen Watt. Jamie Green.
Thank you. First Minister, it will be nearly 2 weeks since businesses were closed before guidance on how to apply for financial support will be fully published. Quite frankly, they've been passed from pillar to post this past week. They've thrown out stock, they've sent staff home, but they still have overheads to pay. And the reality is that every additional day without either income or government support means that some who close their doors may never reopen them. First Minister, knowing this, why was a proper plan not already in place, or indeed put in place quickly to get cash to them immediately? And how quickly will applications be turned around so that the money reaches the bank accounts of those who need it, because they need it now, not in 2 weeks?
When applications open, local authorities will work to turn around those applications and get money as quickly as possible. We put in place a package. We were waiting for details of the Chancellor's package to come last Friday before finalising our own package. And the other general point, before giving a little bit more detail about the support that is being offered to businesses, that I would make is this. We have, unlike some of the decisions elsewhere, we are being upfront in what we're asking businesses to do, which is in some circumstances close and offering financial support. One of the issues, I think, with, and it may be an issue with the Tier 2 restrictions that were published for England, is that hospitality businesses in particular are having significant restrictions put on their ability to trade, but they're not being legally required to close, so they won't get additional financial support. We want to make sure in Scotland that where we are asking businesses to do something that restricts their ability to trade, we are, where we possibly can, within the limits of our resources, giving them financial compensation for that. So the £40 million that we announced last week will be comprised of, firstly, a restrictions fund, which will provide one-off grants of up to £3,000 to bars, restaurants and others required to close by the regulations. That will be based on rateable value. A hardship fund with grants of up to £1,500 that will help businesses that remain open but are being impacted by restrictions. We are also, and this is the bit that we are still working with the UK Government to establish how we can most effectively pay this. We are going to top up the salary contribution in the existing furlough scheme so that we can help workers as well as businesses, which is really important. And lastly, there will be a discretionary fund made available to help businesses that don't fall into the categories I've already outlined, but nevertheless need help, and that could help businesses, for example, in the hospitality supply chain. So this is an important package of support from within the Scottish Government's own resources, and we think it is appropriate and necessary, and we will work with local authorities to make sure that that support gets to businesses as quickly as possible.
Thank you. Maureen Watt, to be followed by Jackie Bailey. Maureen Watt.
Thank you, Presiding Officer. First Minister, last week I asked you whether you agreed that we should move to a system of alert, which would be one of the ways of triggering financial support to employees and businesses and having some consistency on the measures imposed. Clearly, the Westminster Government has gone ahead with the tier system, but without really clarifying the financial support, or I suspect discussing it with the other national governments. You mentioned you'd had a COBRA meeting earlier this week, but can you provide an update on how the four-nation talks are progressing so that we can get some consistency, as well as allowing devolved governments to take the necessary local measures to meet local circumstances?
First Minister.
I'll make 2 points in response to that question. Firstly, we saw the detail of the tiered framework for England on Monday, and that was discussed at the COBRA meeting. I've said previously that we will look very carefully at that as we develop our own strategic tiered approach, and we will try to have as much alignment with that as possible. Members will have heard, and members of the public will have heard, the Chief Medical Officer for England say on Monday that the third tier of the English system, which is the highest tier, at the base level of that probably doesn't go far enough to get infection down. So that is one aspect that we are looking at to see whether we would modify that in a Scottish sense, and we will publish our proposals before Parliament returns, and Parliament will have the opportunity to scrutinise them, debate them and decide upon them when it returns from the October break. The second aspect is how the tiered approach to intervention fits with financial help, and we understand that there is an agreement with the UK Treasury that it will be for devolved governments to decide their tiered approach and what triggers move a part of the country or all of the country from one tier to another, and it will be the decisions we take here in Scotland or in Wales and Northern Ireland that will then trigger the financial support. That's positive. Obviously, with all Treasury schemes, we certainly want to work through the fine detail of that, but we think we have seen positive developments over the last few days and will continue to pursue them constructively.
Thank you. Jackie Bailey, to be followed by John Mason. Jackie Bailey.
Can I thank the First Minister for her statement? She rightly references the COVID-19 advisory group as the Scottish Government's version of SAGE. There is also a subgroup on public health, but I understood that they would be meeting weekly, but I can only find minutes, the most recent minutes from the 21st of September and the 12th of August. So can the First Minister tell me, are the Scottish Expert Group meeting weekly? Will she commit to publishing all the papers that they consider? Because at the moment we only get very high-level minutes. And finally, let me agree with her that I think the need for transparency and sharing that expert advice will assist everybody's understanding of the risks and the measures needed to tackle the virus. Thank you, Presiding Officer.
First Minister.
The CMO Advisory Group meets regularly, and it will often meet in response to requests from the Scottish Government for advice about particular aspects. They publish their minutes, and we will certainly look at what more information, including papers that inform their discussions, can be published. But they are a group that we ask to advise us independently, and therefore they also have to be involved in decisions about what they share about their own deliberations. But we will certainly take that away and give it further consideration. I think there's always room for improvement on everything. I've never shied away from that in this context. But I think we are, generally speaking, pretty transparent about the decisions we're taking and the reasons for those decisions. I know Jackie Bailey was one of those who took issue with this, but the reason I have continued to give daily updates publicly is to try to share as much of our thinking with the public as we can on an ongoing basis, and we will continue to do that. I've already set out steps we will take to try to strengthen parliamentary scrutiny and engagement, and of course we will inform those discussions with as much scientific opinion and evidence as we can. One of the caveats I would make, though, is that I think at an earlier point of this pandemic, we all, probably especially people like me faced with these decisions, like to think that science would effectively almost make those decisions for us. What we've learned along the way is that that is not the case. The science and the evidence can take us so far. Ultimately, people in decision-making positions have to make the judgments and apply those judgments and be held accountable for those judgments, and that's what we will continue to try to do openly, but also firmly and decisively, because of the nature of the threat we're dealing with, which often doesn't wait for governments to go through traditional decision-making processes. I'm not going to comment on what's happening elsewhere. I've got huge sympathy with leaders in parts of the north of England right now trying to come to agreements with central government about decisions that should be taken. But I'm also conscious, and this will apply here during our deliberations, that while we deliberate and seek to come to decisions, COVID is spreading. So we need to be able to act quickly, firmly and decisively.
Thank you. John Mason, to be followed by Rachel Hamilton. John Mason.
Thank you. When it comes to self-isolation, we know that some people will be resistant, but other people want to self-isolate, but they've struggled financially. Can the First Minister say a little more about the £500 grant that's available, how people get it and who gets it?
First Minister.
The importance of self-isolation really can't be stressed enough. It is one of the key ways, possibly the key way we have of stopping the virus transmitting. So if you have symptoms and you then test positive, you should self-isolate to try to avoid passing the virus on to others, and those you've been in close contact with, if you test positive, if they self-isolate, then they can avoid passing the virus on as well. So it's a tough thing to ask people to do, but it is a really essential thing to ask people to do. The new £500 payment, which came into force this week, will be available to people on low incomes who will lose wages because of self-isolation. It will be tied to benefits, principally universal credit. People will have to have been advised to isolate through Test and Protect. They will be required to be off work, so we would encourage employers where people are not ill with COVID to allow people to work from home and continue to be paid as far as possible. But the details of all of that have been set out, and it will be administered by local authorities through the Scottish Welfare Fund, which is a tried and tested way of getting money quickly to those who need it most. We also confirmed this week that there will be a new proactive service, again administered by local authorities. So everybody, this will start with people on low incomes or people that were in the shielding group or people that we know to be vulnerable. When somebody is advised to self-isolate, they will get a proactive call, a 30-minute triage to see if they need support with food deliveries or medicines deliveries, and then they will get 2 further phone calls of a shorter duration during a period of self-isolation to make sure that they're okay, and that system will be rolled out to other groups over the next period. There's also the National Assistance Helpline for anybody who needs it, and I would just take the opportunity to give the number for that in case anybody who is watching needs help. If you can't access help anywhere else, you can phone 0800 111 4000 and there will be practical help and advice available for you.
Thank you. Rachel Hamilton, to be followed by Rona Mackay. Rachel Hamilton.
Presiding officer, we know that wellbeing is important, and in her statement, the First Minister signposts people experiencing loneliness, isolation and anxiety to the NHS Inform website. Without an end in sight for this pandemic, and with winter fast approaching, not everyone has access to the internet. Furthermore, many essential face-to-face services have not resumed. Therefore, can she advise what more her government is doing to help those excluded from digital participation, including the elderly and vulnerable, single parents and people living on their own?
First Minister.
That's an important question, and because I know not everybody has access to the internet, that's the reason I've just read out a phone number to give people the details of a National Assistance Helpline. I'll give it again, 0800 111 4000, and if you need help, it will help to signpost you to where that is. We've also funded over the course of the pandemic a number of organisations to enable them to expand their own helplines. For example, we did that with Age Scotland early on in the pandemic, and there are a number of ways in which we're supporting organisations delivering mental health support, organisations delivering support for those who might be victims of domestic abuse. So that information is available there, and we will take whatever steps we can to make sure that everybody has access to that, either digitally or through the ability to phone a helpline and get signposted onto the help that is needed.
Thank you. Rona Mackay to be followed by Monica Lennon. Rona Mackay.
Thank you, Presiding Officer. Care home residents, as well as their close family and friends, will have been delighted to hear of the extension to visiting times and increased personal interaction, allowing them to hug and hold their hands of their loved ones again. But can I ask the First Minister how these changes will be monitored and reviewed to ensure that we're keeping care home residents safe, as well as supporting their mental health and well-being?
First Minister.
Can I thank Rona Mackay for what is a really important issue, and people who regularly tune into sessions of First Minister's questions or my daily updates will have heard me set out the really difficult balance we're trying to strike with visits to care homes. Firstly, we absolutely must do everything possible to keep people in care homes safe. We know the impact that this virus can have on people in care homes from our experience earlier in the year, but on the other hand, we also know how distressing it is for residents of care homes and for their loved ones if they cannot have normal contact and visiting and interaction. It's not an easy balance to strike, but we are trying hard to get it right. The new guidance is in place is guidance. Care home providers who feel that they are not ready to offer that level of interaction are not forced to do that, and there are lots of protections that are in the guidance to make sure that risks are not being taken that are not appropriate. So the guidance recommends easing restrictions only if certain conditions are met. Firstly, a care home must have been COVID-free for 28 days. They must be actively participating in the weekly care home testing programme. We must have their risk assessments approved by the local Director of Public Health. In cases of physical contact, appropriate PPE must be worn, and physical distancing is still recommended for all circumstances, unless in the cases where other protections are taken and touch and closeness is beneficial. So these are really stringent protections, and we will keep all of this guidance under review as we try to strike that difficult balance as best we possibly can.
Thank you. Monica Lennon to be followed by June McAlpine. Monica Lennon.
Thank you, Presiding Officer. South Lanarkshire is currently the council area with the highest positivity rate, where the Hamilton area is accounting for almost half of all COVID-19 cases, and there are other notable hotspots including in Larkhall. What is the Scottish Government's understanding of what factors are at play in Hamilton, Larkhall and the South Lanarkshire area? Are there any plans to extend the school holidays in South Lanarkshire or indeed elsewhere in Scotland? And finally, it is very welcome that Hamilton is getting a mobile testing unit. Can I ask the First Minister what other resources will be made available to NHS Lanarkshire and South Lanarkshire Council in the days and weeks ahead?
First Minister.
That we're seeking to make available to councils, health boards, and we'll set those out in detail. Many of them have already been set out. Testing and the provision of local access to testing through mobile testing units, and increasingly the new walk-in centres that are being established is important. And we are also through innovation technologically, we are increasingly starting to trial and hopefully then use point of care testing technology, which again will allow much greater ease of access. We know that certain areas have particularly high levels of infection, and that is guiding the decisions that we are taking. I would say the information that Monica Lennon has just been able to share through her question is available through the new Public Health Scotland resource, where anybody can go onto the Public Health Scotland website and see the current infection level in their own neighbourhood. And neighbourhood is defined as usually a part of the country with 4,000 people there. So it's very localised information, and our incident management teams that look at the situations locally and nationally will use the data to guide the decisions we are taking. Much of what we are doing right now, and one of the reasons why we took the decisions to impose household and hospitality restrictions at a relatively early stage, was that we want to keep schools open, because it is really important for the well-being and education of young people that we do so. We can't rule anything out in the face of what we're dealing with right now, but a key objective is not to have schools closed beyond the normal holiday periods, and that is why we're asking others to, sacrifice going to the pub for a pint, or going out for a meal, or coming together in each other's houses. It's these sacrifices that are necessary to get the virus under control, but will then, we hope, enable children to continue to go to school as normal. But we keep all of this under review, guided by the data and the evidence on an ongoing basis.
Thank you. Joan McAlpine to be followed by Oliver Mundell. Joan McAlpine.
Thank you very much, Presiding Officer. Can I ask the First Minister if she would encourage Sky Sports to make the Old Firm match free to watch this weekend, to remove any motivation for people to gather in each other's houses to watch? And can she confirm that her important advice that football fans should not travel from Scotland to Blackpool to watch the game in a pub also applies to anyone planning to travel from Dumfries and Galloway to Carlisle to watch the game in a pub this weekend?
First Minister.
Yeah, I strongly endorse all of that. I said yesterday that people should not, if they can avoid it, travel to Blackpool. That's not because I've got anything in for Blackpool. Blackpool's a great place. Many people in Scotland love going to Blackpool at this time of the year. Lots of us have got very happy childhood memories of trip to Blackpool, and we look forward to getting back to normal. But we know through Test and Protect that a significant number of people who have travelled to Blackpool have gone on to test positive for COVID. We can't be certain that's where they got it, but it is an increasing theme of the Test and Protect interviews. So people should not travel to Blackpool right now if they don't have to. And that applies particularly to Old Firm supporters this weekend. We know or have heard some suggestions that some of them may have been planning to travel to Blackpool to watch the match in pubs. Please don't do that. I know how important football is to so many people across the country. Old Firm matches are big occasions. Everybody understands that, but please watch at home. Don't travel elsewhere to watch it with other people, either in pubs outside of your own area or in other people's homes, because by doing that you're putting yourself at risk and you're putting other people at risk as well. And that certainly applies to football supporters from Dumfries and Galloway or anywhere in Scotland who would be thinking of going to other parts of England, to Carlisle, for example. It is a really bad idea to do that, and I would ask people not to do it, to stay at home and watch the football, which is why finally I really do strongly agree with Joan McAlpine and would encourage Sky Sports this weekend to make the Rangers-Celtic match free to view for supporters as a small but important contribution that they could make to helping keep people safe right now, enabling people to watch the match in the comfort and the safety of their own home and not be tempted, reduce the temptation people who don't have access to the pay-to-view services might have to go and watch the match somewhere else. So if anybody from Sky Sports is listening, I would encourage you to think about making the match free to view this weekend.
Thank you. Oliver Mundell to be followed by Alec Neil. Oliver Mundell.
Thank you, Presiding Officer. I note the First Minister's comments about avoiding high-risk areas elsewhere in the UK, but will she guarantee today that whatever the public health decisions our government take, that my constituents who live and work on both sides of the border will continue to be free to travel to England and back, where such travel would otherwise be permitted if it were undertaken solely within Scotland? And does she agree with me that attempting to close internal borders within the United Kingdom causes significant concern and anxiety for many?
First Minister.
A global pandemic causes significant anxiety and concern for many, and I think what people, the vast majority of people, look to their governments to do is take whatever action they deem is necessary to keep people safe from an infectious virus and to stop people dying. These are not constitutional debates or decisions, they're not political debates or decisions, and I would really encourage everybody not to see them in that way. The First Minister of Wales is not a known nationalist. He doesn't support independence for Wales, but he understands the public health importance of making sure that people from high prevalence areas in other parts of the UK don't travel into Wales and vice versa. I understand that in the Scottish context, and I hope across the country. I wrote to the Prime Minister last night looking for 4 nations discussion so that we can come to a common sense agreement on how, where necessary, we restrict travel to keep people safe. And countries the world over are doing these things right now, and nobody there, to the best of my knowledge, is making political or constitutional points about them, because they recognise the public health imperative. And of course, in any travel advice we give, we always exempt essential travel, which would include travel on the part of people who have to go to work. We are encouraging people where possible to work from home, and that applies to Mr Mandel's constituents as it applies to people across the country. But where people have to travel to work, that is an exemption from any travel advice we give, and that would be the case with cross-border travel, just as it is the case for our advice to people travelling from Glasgow to Edinburgh or anywhere within Scotland. For goodness sake, let's be sensible and grown up about these discussions. There is plenty of time in the future, I hope, when we're out of this pandemic, to get back to the traditional debates we all enjoy having. But for now, let's all keep focused on the public health imperative of keeping people safe from this virus.
Thank you. Alec Neil to be followed by Neil Bibby. Alec.
Thank you, Presiding Officer. Can I ask the First Minister when she expects to be in a position to evaluate the impact of the additional 16-day restrictions imposed during the current COVID reset, and in particular whether the scientists are able to identify the particular impact the temporary hospitality measures will have had on the R figure?
First Minister.
Assess the impact of all of the measures we're taking right now on an ongoing, literally on a daily basis. We look at growth rates in the virus, we look at cases per 100,000, we look at the direction of travel in those. We do that nationally, and we do that in every part of the country. We also assess, and our clinical advisors assess, the impact of measures on a more medium, in the context of this virus, a more medium-term basis. We know there is a lag effect between implementing measures and seeing the impact of those, because of the incubation period of the virus and the time it takes somebody who gets infected to display symptoms, and then if they're going to become ill, be admitted to hospital, and unfortunately, in the case of some, to die from it. It may not be that by the 26th of October we know all of the impact of the temporary restrictions that are in place, but we will be able, I hope, to have an initial assessment from our advisors of the effect that they're having, and that assessment will then guide the decisions we take about what replaces the temporary restrictions and what parts of the country we would propose going into what tier of our new tiered strategic approach that I spoke about earlier.
Neil Bibby to be followed by Christine Graham. Neil Bibby.
Thank you, Presiding Officer. Scotland's pubs are being hit hard by these restrictions, but many of them were getting an unfair deal before COVID. Today, Heineken were rightly fined £2 million for serious breaches of the statutory pubs code in England and Wales, yet there is no statutory regulation of pub codes here in Scotland. To give fairness to Scotland's publicans, to help the sector recover from these restrictions, to build back better after the COVID crisis, will the Scottish Government support my Thai Pubs Bill next month? It has the backing of Scottish small businesses, trade unions and consumers. Only the multinational discredited pub codes stand in the way. Will the First Minister agree that Scotland's publicans need a fair deal now more than ever?
First Minister.
I agree, the publicans need a fair deal. We will certainly consider the terms of the bill and make decisions on the basis of that assessment, and we look at all proposals with a sympathetic eye. More generally, the guidance that is in place for hospitality has a statutory underpinning in Scotland, but one of the things that we will be doing as we move to the new strategic approach that I've spoken about, looking across different sectors, and this will include hospitality, at the ways in which it may be necessary for us to tighten up restrictions and indeed tighten up the enforcement regime that goes around those restrictions. As I said last week, we have already asked retail to return to a 2-metre physical distancing and many of the measures they had in place earlier in the pandemic. So we will be looking at that in the context of hospitality as well, and that will include pubs.
Thank you. Christine Graham to be followed by Maurice Golden. Christine Graham.
Thank you very much, Presiding Officer. First Minister, you referred to the Welsh rules on travel restrictions from English COVID hotspots. I already have constituents in Melrose and in Innerleithen, for example, very concerned at the influx of tourists from England, but they don't know from which area of England. How close is the Scottish Government to replicating the Welsh Government's restrictions on travel bans and travel bans in this regard? And how will people regularly crossing the border for essential work, how can it be policed?
First Minister.
Well, we're looking carefully at the Welsh approach as of yesterday, when Wales announced that it would introduce regulations on cross-border travel. I think they were still finalising their own regulations. We will look at that when we are able to. I don't want to minimise, though, the issues here. We have guidance that we give to people. I've given it again today, tried to be very clear about what we are asking people to do and, more importantly, not to do in terms of travel. I think there is an argument, and I think we have to keep it under consideration both within Scotland and in terms of travel from Scotland to and from Scotland from other parts of the UK, about making that more regulated and having a legal underpinning to that, and that is what we are considering at the moment. But that throws up, as it does with guidance, it would do too with a more regulated approach, practical challenges around enforcement. The police cannot stop everybody coming into or leaving Scotland. Some people would have legitimate reasons to be travelling, so we have to think through those practical considerations. But at a time when we are all trying to suppress the virus, at a time when we know importation of the virus from outside the UK, but also from one part of the UK to the other is a risk, it would be remiss of us not to be looking seriously at how we strengthen our ability to restrict travel from high to low prevalence areas. And I want to be very clear to Parliament, just to be open, that is very much something that is under active consideration. But if we decide to do that, we will set that out fully, and we will set out the issues and how we intend to address the issues around enforcement as at the time we do it.
Thank you. Maurice Golden, to be followed by James Dornan. Maurice Golden.
Thank you, Presiding Officer. Concerns have been raised by Scottish Care over the poorly managed flu vaccination programme. The First Minister said vaccinations were an absolute priority. So can she ensure that the most vulnerable, many of whom have been let down by the response to the coronavirus crisis, will not fall victim to winter flu?
First Minister.
The flu vaccination programme is crucial and critical. That is true every year. It is particularly true this year, given that we know the risk of concurrent infection with flu and COVID, and also we know that if we have many people with flu at the same time as we're dealing with COVID, that will put additional pressure on the NHS. So the flu programme is crucial. It is being delivered differently this year because of COVID and the challenges of people going to get the flu vaccine in the way they usually would. The flu vaccination programme is going well. There have been some challenges. I'll come on in a second to one of those in particular. But health boards estimate that by the end of this week, more than 600,000 people will already have been vaccinated. That's around 25% of the total that will receive the vaccine that will have already received it. There have been issues raised in the last day or two, particularly about Greater Glasgow and Clyde, but it may affect other health boards because the same system will be used, about the lack of prioritisation within eligibility, and in particular about some older people not being prioritised for a vaccine early on in the vaccination schedule. Scottish Government officials were in very close contact with Greater Glasgow and Clyde about that yesterday, and have talked to them about the steps that they will be taking to make sure that older people in the most vulnerable categories are prioritised for appointments. I think that is important. But the overall vaccination programme is progressing and will continue to progress over the weeks to come.
Thank you. James Dornan, to be followed by Lewis MacDonald. James Dornan.
Thank you, Presiding Officer. First Minister, the Jenny Burns Centre in Castlemilk in my constituency has sensibly and understandably been closed since March. As a free-flow, multifunction community facility, its trustees believe it is still not safe to reopen and return to use. However, the UK's furlough replacement, the job support scheme, will only support businesses whose premises have been legally required to close due to local coronavirus restrictions, and this doesn't apply to the Jenny Burn. Could the First Minister tell me how the Scottish Government can support businesses and charities like this? And will the First Minister also continue to urge the UK Government to extend the existing furlough scheme to help charities such as the Jenny Burn Centre get through this pandemic?
First Minister.
Can I thank James Dornan and pay tribute to the Jennyburn Centre in James Dornan's constituency and organisations like it across the country who have found themselves very severely impacted by this pandemic. We in the Scottish Government have provided, since the start of the pandemic, substantial funding to charitable organisations to help support them through this period. That's in addition to the £2.3 billion of support that has gone to businesses. But what James Dornan has just outlined there in relation to the Jennyburn Centre is an example of the shortcomings of the job support scheme, and while the support incorporated in that is welcome as far as it goes, it doesn't go far enough. It doesn't provide a sufficient level of support, and of course it doesn't necessarily provide support to organisations in the position of not being required to close but voluntarily restricting their operations to keep people safe. And so I can give an assurance that we will continue to constructively, I hope, discuss with the UK Government how that scheme can be improved and make sure we have the level of financial support for businesses and organisations that is commensurate with the steps we are asking these organisations and businesses to take to keep people safe.
Thank you. Lewis MacDonald, to be followed by Edward Mountain. Lewis MacDonald. Now, I wonder, Mr. MacDonald, I'm sorry, your microphone isn't working. Just could you start again? We'll see if you get your microphone working. Mr. MacDonald. No, I'm not quite sure what the problem is, Mr. MacDonald. We seem to have a problem. Would you mind, Mr. MacDonald, if we'll move on to Edward Mountain and I'll come back to you in a second. Is that all right? Edward Mountain, and we'll come back to Lewis MacDonald. Edward Mountain.
Thank you, Presiding Officer. I don't know if you can see my video appears to be off, but
we can hear you, Mr. Mountain.
Okay, thank you, Presiding Officer. First Minister, I received no response to the urgent emails that I sent you on the 29th of September and earlier this month on this specific subject. First Minister, I was contacted by a constituent who is currently at home with terminal cancer. Now, Amanda is on her short and final journey and naturally wishes to see her family and her grandchildren. She's not up to going to a local cafe or hotel. Furthermore, the weather and her health are not suitable for an outside visit. Now, she doesn't want to ask them to break the law, and her family, like many others, I suggest, are in this difficult situation. Do you agree with me that we should do everything we can to allow families like this to see their children and their families? And will you do everything in your power to review the situation to allow this to happen without people breaking the law?
First Minister.
Yes, I do. I'm sorry you haven't had a response to an email sent, I think you said on the 29th of September. I'm sure you appreciate there are lots of emails come in, but I will make sure that that one is identified this afternoon and a response comes to you. If for some reason we haven't received it, I'll make sure my office gets in touch with yours. Can I also just take the opportunity to send my best wishes and thoughts to Amanda at an unimaginably difficult time for her and her family. Of course, we want to do everything possible to allow families to be together in the final stages of a loved one's life and strive to make that possible in as easy a way, if that's not an inappropriate word in the circumstances, as possible. So obviously I don't know all of the precise circumstances of Amanda's situation, but I will make sure that the email is looked at today and we get a response as quickly as possible to make sure that Amanda hopefully can see the loved ones that she so understandably wants to see.
Thank you very much, First Minister. I'm going to try Lewis MacDonald again now, to be followed by Joanne Lamont. Lewis MacDonald. Sorry, Mr. MacDonald, I think you're going to have to press your own microphone. I think the problem is maybe if you control it yourself, Mr. MacDonald, try and put it on yourself. No, we're still having difficulties. Sorry, Mr. MacDonald, we'll try one more time. I'm going to go to Joanne Lamont and then we'll try one more time, Lewis MacDonald. Joanne Lamont next, please.
Thank you. The First Minister will be aware that many services available pre-COVID were withdrawn during the early stage to the crisis, including care for older people and disabled people in their own homes.
Oh dear. First Minister, we seem to be beset with problems at the end of this broadcast, but I'm going to try one more time with Lewis MacDonald, and if not, Neil Findlay also wishes to ask a question. So, Lewis MacDonald, we'll try one more time. And this isn't working, no. Sorry, Mr. MacDonald, I think we're going to have to abandon this one. Neil Findlay, can we have a question from Neil Findlay?
Thanks, Presiding Officer. Staff who support older people in care homes are regularly and routinely tested, but staff who support older people in their own homes or in hospital aren't. First Minister said earlier that science only takes us so far and then political decisions need to be made. So can I ask you now to make the political decision to routinely test all health and social care staff?
First Minister.
That is one of the proposals that we are actively considering in the review of the testing strategy that I've spoken about. I refer to regular visitors to care homes, but care at home staff are another group, and I hope Neil Findlay will take from that an indication of the direction we are going in, but we will set out the outcome of the review of the testing strategy, as I said, when we return to Parliament, so that Parliament can properly scrutinise that. But suffice to say, I agree with the sentiment behind the question. Presiding Officer, can I also say, if it's not possible to make contact with Lewis MacDonald and Joanne Lamont, if they want to email my office their questions later today, I'll endeavour to get an answer to them.
Thank you very much, First Minister. I think I'll take you up, or the members will take you up on that. We've got one final question from Pauline McNeill. Pauline McNeill.
Thank you, Presiding Officer. First Minister, you said earlier that there was a discretionary fund for businesses, and many businesses in the hospitality sector, as you know, are struggling, particularly the short notice that was given this week for the lockdown. Some businesses are saying that they might not be required to close because businesses around about them are closed, that they may be able to retain jobs better if they had the discretion to close and protect those jobs. So I wonder if the First Minister at some point to give a bit more detail about the discretionary fund, and would she consider some flexibility for those businesses that don't require to close, but because no one's attending the business, that they could benefit from a discretionary fund?
And First Minister.
Yes, we'll set out more details of the discretionary fund as soon as possible, but can I make the point that there is another part of the support package, a hardship fund, I said this earlier on, that will support businesses that remain open but whose business is directly affected by the restrictions. And obviously I don't know the details of the businesses that Pauline McNeill is referring to, but it may be they fall into that category, and that provides support of grant support of up to £1,500 per business. That's in addition to the discretionary fund, and we'll set out more detail of that shortly.
Thank you very much, and apologies to Joanne Lamont and Lewis MacDonald. The First Minister has offered to try and get as soon as possible to any written questions you can put to her. And I thank all colleagues though for their contributions today. That ends the First Minister's statement. Parliament will resume with a chamber session, or a hybrid session I should say, on Tuesday the 27th of October. But on that note, can I say thank you very much, and Parliament is closed.
Imagine
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, no, there isn't one person in Scotland that can okay it unless it was through London.
Good morning and welcome to another edition of Full Scottish and what's happening today.
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland's going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon as our First Minister has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
There is now and forever will be known as a rape cause.
I'm old enough to remember going into Europe in '73 and I remember how much of a razor-edged that was balanced. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British, whether it felt European. And that schism, that crack has remained through English society ever since.
Scotland means business. Scotland's voice won't be stilled. It won't be silenced. It has to be heard.
The work that has been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets